evening to all. The 58th medical term that we'll be discussing today is the disease condition rheumatoid arthritis. As we know, the suffix itis refers to inflammation. This is inflammation in the joint regions, that is, the connection between two bones. If you look at the pathophysiology, the basis of this inflammatory condition is an autoimmune condition. And as we know, when you say joints, it's part of the skeletal system, which can be all over the body. So it's not acute, it's generally a long term condition. So, what exactly do you mean by autoimmune? So, if you look at the term autoimmune as a literal meaning, auto means self, immune is like protection against self antigen. But if you look at it more further, when the immune system tries to protect against an antigen, they try to fight. So the fighting ultimately destroys the self antigen. We can destroy our foreign antigens, but we can't destroy our self antigens. Self antigens present on mainly the synovial cells. Synovial cells that produce the synovial fluid, which is present in the joints, which provides a lubrication. So people suffering from RA generally suffer from joint pain, swelling, stiffness, and even sort of tiredness due to this. And not only that, it can affect like even the bones like the ribs, so therefore there can be heart problems, a shortness of breath, and of course bone loss. So what are the risk factors? As we said before, mainly it is an autoimmune. So the autoimmune reactions can happen due to various reasons, like mimicry of the antigens, like the evasion of the foreign antigens, isn't it? And even due to these abnormal immune responses. And we know autoimmune means when the tolerance is lost, it can be central tolerance as well as peripheral tolerance. When the tolerance is lost, self antigens are attacked, or environmental triggers which can cause our self antigens to be mutated. And even some studies show the demographics, like females are more prone to suffer from this RA, or individuals with between 30 to 50 years. So you can diagnose this by looking at the physical examination, or you do some blood tests to find out the rheumatoid factors, then even C-reactive protein, which is an acute phase protein, and even X-rays to see the damages that have occurred on the joints. So you can treat them using disease-modifying anti-rheumatic drugs, DMARDs, as well as non-steroidal anti-inflammatory drugs, or in support with physical and occupational therapy.